Also, leaders in several cities and states are imposing new restrictions as coronavirus cases rise. Now, Costco making changes to its in-store policies. News Nation's anchor Rudabeh Shabazi explains that.
Yeah, well, Costco has been requiring customers to wear masks since early May, but now the rules also apply to those with pre-existing conditions who were previously exempt.
Starting Monday, people over the age of 2 who were previously exempt from face masks due to a medical condition will have to wear a face shield instead. Costco president and CEO Craig Jelinek sent a letter to customers saying, quote, "This updated policy may seem inconvenient to some. However, we believe the added safety is worth any inconvenience."
Everyone should wear a face mask because that's the intelligent, safe, and prudent thing to do. There should be no exceptions. You're protecting yourself and others.
I don't think it's debatable at this point.
On a crowded day at an Illinois Costco, while customers said they felt safer having everyone covered with a face mask or shield, some could see why those with pre-existing conditions like asthma or emphysema would ask to be exempt.
I used to work in a really busy grocery store, and the biggest concern of people, or complaint rather, was oh my gosh, I have asthma, like I can't breathe, basically. So that was the big concern, was if they had existing health conditions, which makes it really tricky.
There is absolutely no doubt that wearing masks prevent this spread.
Dr. Edward Ward treats COVID patients in a busy ER and says wearing a mask, symptoms or not, is what will protect you and others.
I'm sympathetic to the folks who have those underlying medical conditions, but the other thing that we found is, they may be the people who are at risk for having the worst complications from this. So I would say those folks, more than anybody, really need to protect themselves. And that's either by wearing a mask or staying at home.
A new study by UCLA investigating the effectiveness of face coverings backs up that science. The researchers found that even a simple cloth covering reduces the spread of respiratory droplets that carry the virus by as much as 77%, and a face shield on its own reduced cough particles by 4%. Face shields and masks worn together reduce the spread by up to 89%, according to the study.
If you really have some type of pulmonary condition, some type of lung condition that really makes it, extremely difficult to wear a mask, then the face shield would be the next best thing. But I would say the real key here is limiting your exposure to the very minimal amount of trips you need to make and wearing the mask as best you can.
And the authors of the study called mask wearing a no-brainer and said stricter mitigation measures should be adopted for indoor environments, which are more likely to be enclosed and crowded.